Hello everyone, I'm Mary Rose Corrigan, Public Health Director for the City of Dubuque with a special pre-holiday season COVID-19 update from the Dubuque County Public Health Incident Management Team. First of all, a look at the local COVID trends. As you can see on the screen, since early October, COVID cases in Dubuque County have continued to rise. And over the past few weeks, the higher level of reported COVID cases has remained at this higher level of greater than 100 cases in a week's time frame. Our two hospitals are also very busy with high numbers of patients with respiratory illnesses. Since we know cases and spread are continuing, now is the time to prepare for the upcoming holiday season, starting with Thanksgiving and through the new year. So how do we gather safely? Especially since our gatherings will be indoors? Well, here are your holiday preparation tips. 1. Be up to date on your vaccines, including getting the most recent bivalent booster, which research shows is highly effective against severe illness and death against COVID-19 and the B4 and B5 variants, the dominant strain circulating now. 2. Think about protecting the vulnerable, such as grandparents and elderly, very young infants and children, and those with underlying health conditions. Protect these folks by these steps. 1 week before the gathering, wear an N95 mask everywhere you go. Then, the morning of the event, do a home COVID test and have all who will be in attendance test too. The test won't pick up all infections, but according to research published in Clinical Infectious Diseases Journal, the average at-home test will catch 44 to 70% of asymptomatic cases. In other words, people that don't have symptoms. If you do have COVID before the event, it usually will last 8 to 10 days. You may not be infectious that whole time, however, but there's no way to tell unless you test negative with an at-home test kit. So if your COVID symptoms have improved, do a home test kit, and if it's negative, we know a negative result with these tests are very reliable for letting us know when we're not contagious after a COVID infection. The day of the event or holiday gathering, remember to have well-ventilated spaces. This can be accomplished by periodically opening the windows, or passing air through portable HEPA air cleaners, or assuring the circulation through a filter is a minimum efficiency. Most importantly, if you have cold, flu, or COVID symptoms, stay home. Even if you do test negative, you don't want to spread another respiratory illness or influenza to others at your holiday gathering. Which brings me to my next point, other respiratory illnesses. Dubuque County and the rest of the country are experiencing surges in respiratory illnesses of which we've seen very little of in the last 2 to 3 years. Our local pediatricians have put out a call to the Dubuque community warning of increasing rate of RSV and other respiratory viruses. RSV hits children 2 years and younger the hardest. The pediatricians wrote a letter to the entire county which states, "This perfect storm of influenza and RSV infections in the community have led already to a large number of children requiring hospitalization and critical care, up to and including the use of ventilators to assist breathing." Currently, pediatric ICU beds are full across all children's hospitals in the Midwest. This means that we are caring for a greater number of very sick children at our local community hospitals, while at the same time our bed and staff capacity is stretched significantly. The Pediatrician Letter further states, please get your influenza vaccine as quickly as possible and keep your children's immunizations up to date. Infants 6 months and older should receive flu shots, as young children in particular are at high risk of severe illness from this virus. If you or your children are ill, strongly consider isolating until symptoms are improved. And families with very young infants, less than 3 months old, should limit visitors and avoid contact with sick friends or family. From a public health perspective, I wholeheartedly support our pediatricians' plea. The fact is, we have very limited hospital capacity and capability for seriously ill young children. What we do have, however, are tools to lower and prevent transmission of RSV, influenza, COVID, and other respiratory viruses. And I don't care how much you disagree with me, vaccinations protect. Staying home when you're sick limits transmission, and covering your cough and washing your hands frequently protect you and others from these ever-increasing illnesses. So as we think about all the things we are thankful for, including family and friends, a Thanksgiving meal, our schools and healthcare providers, and a community that cares, I truly appreciate all the random thank yous I receive from strangers and people I know. But good health is always at the top of my thankful list. Practice the staying healthy tips I talked about today, and yes, it's okay to indulge in some pumpkin pie. Thank you for tuning in.